Donna, the Liberals are campaigning heavily on health care here in Atlantic Canada, where it is a huge political issue. In fact, last week's Nova Scotia election was fought and may have been won on it. Here in Newfoundland and Labrador, nearly 90,000 people are without a family doctor. And if the Liberals hope to get a majority, they need to win over Atlantic Canadians on issues like this. On Monday in Halifax, Liberal leader Justin Trudeau promised $6 billion to reduce healthcare wait times and another $3 billion to hire 7,500 doctors and nurses.
This is our moment to rebuild a healthcare system that works for all Canadians.
If that sounds familiar, it's because he made a similar promise in the 2019 campaign, that every Canadian would have a family doctor. 2 years later, that hasn't happened.
These are kind of empty promises. I mean, they have to attach the money to actual teeth. There have to be strings attached to say, to get the money, the provinces have to do X, Y, Z, and there needs to be leadership. And that's really what's missing here.
The federal government doesn't hire doctors. That's the province's job. And the premiers have been clear about what they want, making their demands on Ottawa just before the last federal budget,
when health matters more than ever.
The Liberals have promised an increase to health transfers after the pandemic, but have not said how much they would spend, only that the federal government supported the provinces during the pandemic. The NDP said they would increase healthcare spending, but without details on where or how. The Conservatives are the only party to lay out their healthcare platform so far, with Erin O'Toole campaigning on an increase to health transfers from 3% to 6%, which works out to about $60 billion.
I 100% support our public and universal healthcare system. In fact, it's been the backbone we've relied on through the pandemic.
Mercedes Stephenson, Global News, St. John's.
There's a bit of a kerfuffle going on over a campaign video the Liberals released. Twitter flagged it as manipulated media. It shows Conservative leader Erin O'Toole expressing support for a private, for-profit healthcare system, but a key part of his message was edited out by the Liberals. Couteur explains what happened and the fallout.
We can't have just one old model.
The year-old video seems to show Conservative leader Erin O'Toole speaking in favor of two-tier health care. It was tweeted by Deputy Prime Minister Chrystia Freeland, but Twitter quickly slapped this label on it, flagging it as manipulated media.
Canadians deserve better than that.
Monday, O'Toole said he 100% supports Canada's public universal system, and he slammed the Liberals for the smear.
Misleading people, importing American-style media manipulation to our campaign within the first 10 days.
Leader Justin Trudeau's defense of the edited video was to point people to the unedited version.
In the middle of a pandemic, Erin O'Toole came out unequivocally in support of private health care in terms of for-profit health care.
Now, it's not that clear when you watch the full version, because in one breath, O'Toole says universal access is paramount, and in another...
And I actually praised what Brad Wall did with respect to diagnostic imaging, because he's actually making sure that wait times for everyone go down.
NDP leader Jagmeet Singh says the campaign is entering dangerous territory.
It is really disconcerting, though, that the current party in power is engaging in exactly what we need to be ending.
This former Liberal staffer and current communications expert says Twitter was overzealous in labeling the tweet manipulated.
The minister was only taking a direct quote and putting it out there in a short format, which is what you need for online.
The Tories don't see it that way, and the party is asking for an investigation to see if the Liberals violated the Canada Elections Act by intentionally altering the video. Donna?
All right, Couteur, thanks.